Hi everybody, welcome to my channel. In today's video, I would like to discuss what exactly do they teach in advanced standing programs. I get a lot of questions about what do I study in advanced standing programs. A lot of people don't actually know the difference between specialty and advanced standing program. And because I was in two different advanced standing programs, I think I have a little bit of expertise about advanced standing program curriculum. So in this video, I want to discuss what exactly the subjects that I go through in my school, and hopefully it's going to be helpful. I think this video could be specifically helpful for people who are not sure if they want to go to advanced standing program or if they want to go to specialty program, and I think this can help clear their doubts a little bit. So as I mentioned, I went to two different advanced standing programs, one in University of Oklahoma and another one where I am now in Boston University. If you don't know why I did that and how I ended up in two different programs, you can check my video on that. I will link it somewhere. So there are two different kinds of advanced standing programs. First kind is just like University of Oklahoma, where advanced standing students join the American class. They actually start taking the same classes as the DMD class, usually second or third year, and they just go along with the curriculum, and it would most of the time it would not differ from anything that American students would do in American dental schools. Or another option like BU, where advanced standing program is actually advanced standing program and they have nothing in common with the DMD class. So every program consists of two parts, is a preclinical part and clinics part. So preclinical part is the part where you don't see any patients and you just focused on your lab work and practicing your skills on the fake plastic teeth, and also didactic part, which is lecture and exams. In Oklahoma, the preclinical part took half a year out of 2.5-year program. Boston University, unlike Oklahoma, the preclinical part takes a whole year. So the whole half of your program, because the program is 2 years, you don't see any patients at all. I've been in various American schools for a year now, and I'm yet to see a single patient. Preclinical course in Oklahoma and in BU consist of mostly focused on fixed prosthodontics, operative, endo, radiology, and periodontology. So I want to talk a little bit about fixed first, because fixed in Oklahoma was a very prominent course. As you know, probably the licensure exams are focused on fixed prosthodontics as well, so you are taught to be prepared for that specific exam. In Oklahoma, I was actively only involved for 2 months before COVID started, and I must have prepared around 50 to 60 crowns because it was so intense. We would be prepping constantly. I learned more clinical skills in Oklahoma that I learned in BU for the entire half a year that I've been there now. In 2 months, I learned much more. And basically, we prepped a lot of gold crowns. We prepped a lot of PFMs. We practiced bridges and stuff like that. We didn't focus a lot on temporizing. We didn't focus a lot on the adjacent areas of fixed prosthodontics. But in Boston University, unlike Oklahoma, we are actually really focused on temporizing technique. Our exams always consist not only of a prep but also a temp, which is really good. And fixed course here is very intense. We're also doing veneers, which we never did in Oklahoma. So concerning fixed, I learned more skills of prepping actually in Oklahoma, but a lot of adjacent skills that are also very necessary, like temping and scanning and designing it and CEREC, I learned in Boston University. Next thing I want to talk about is operative. Operative is basically fillings. Most of the course is focused, of course, on class 2 fillings. It's one of the most common classes of fillings dentists have to do, but in Oklahoma we did a lot more amalgam fillings, which was helpful because people still use it, and it depends on economic situation. Amalgam is still widely used, and also of course composites. Another thing I want to talk about is RPD, or removable prosthodontics, which was very unnecessarily extreme in Boston University, and it was kind of light, understandable, and easy in Oklahoma, which I probably enjoyed Oklahoma better. But in Boston University we did complete dentures and partial dentures. In Oklahoma we only did partial dentures, but I think I just didn't get to the part where we were talking about complete dentures. But the course in Boston University is so in-depth that I probably don't want to know that much about dentures, but I have to, I guess. So I didn't really enjoy the course, but it was very strong. You actually know how to, I actually know how to do a denture now, so I guess that's what you want from it. Also, implant supported dentures, which we did not definitely study in Oklahoma. Another course that I want to talk about is Endo. Endo was very different in both schools. I feel like Endo is very, very weak in Boston University. We didn't do a lot of things. We were practicing on plastic teeth most of the time, and we definitely didn't do every single tooth in the mouth, unlike Oklahoma, where we were focused on every single tooth of the mouth. There were requirements for us to complete every single tooth so we could pass the class. In Boston University, it was not like that, because we would be allowed to pick and choose our tooth. Like, of course you would choose like central incisors most of the time because it's one canal, or canines, and it was not allowed in Oklahoma. The structure of the course was much different in both schools. So Oklahoma was definitely more strong and more thought through curriculum than Boston University. Endo course took almost the entire time, half a year in Oklahoma, and in Boston University it only took about 2 months and the entire course was finished. So actually, if I only was in Boston University, I feel like I wouldn't be prepared for Endo in real life. So Endo is pretty weak, but it is taught, and I feel like it really, really varies school by school because there's so many techniques to do Endo. Everybody does it differently, everybody uses different instruments because there's such big variety. But I just wanted to say that Oklahoma is a great school if you're interested in Endo. Now I want to talk about Perio Class, and Perio is basically scaling and root planning is what you learn in a preclinical lab. You get those mannequins with calculus on them and you try to remove them. And in Oklahoma it was very intense course. We would literally sit down for hours, like 2-hour class. We would literally be scraping, and just to learn the grasp of the instrument. But in Boston University it's a little different, so I guess Perio is a little more interesting, definitely in Boston University. So we also had the lab classes, how to actually use the scalers, but then we went to clinics and we practiced on ourselves, on our classmates, how to scale, which was actually a really fun experience. So there were a lot more activity in the course in Boston University, which I also really enjoyed. The professors are incredible. I really enjoyed Perio in Boston University, but actually skills-wise, I think I learned more in Oklahoma in that class. Another class that I really want to talk about is X-ray and radiology. So they basically teach you how to do X-rays. We all know how to do X-rays because most of people worked as dental assistants in their days. And in Oklahoma, it was a very, very good course. I loved that course. The professor was incredible. She explained everything, every pathology you could possibly see. You learn all the areas on panel, well, basically what you need to know for radiology. But also we had clinics where we would go and there would be fake little heads with teeth and we would take x-rays of them, and the positioning was very exact. If you are a little off of what they want your x-ray to look like, you would lose a point. It was actually pretty difficult to do. In Boston University, that course is very unorganized, and we're supposed to have those clinics where we learn how to do x-rays, but we still hadn't have them scheduled. So if people are kind of rusty on how to do x-rays, I feel like they will have a lot of problems in Boston University. So I'm yet to tell you, I yet to see the radiology clinics here, so I'm not sure how they go in Boston University, but I can tell you that I'm sure in most schools, what you do basically is take x-rays of plastic teeth. And there's a lot more to it than actually assisting, because when you're an assistant in real life, you kind of hurry through it and you just take a quick picture. It's just an everyday routine, and here you actually have to follow all of the protocols and take perfect pictures every time or you will fail your exam, and it counts for your GPA and your grade. So radiology clinic is something I really enjoyed, but it's a really hard course. Another class that I want to talk about that was in Oklahoma, but I didn't see it yet in Boston University, I hope I will have that class later on, is Pediatric Dentistry. And let me tell you how difficult it was in Oklahoma. Pediatric Dentistry was basically like military in Oklahoma, in University of Oklahoma. Our professor would literally have a timer and say, you have 15 minutes to prep 4 teeth on 4 quadrant teeth, remove your rubber dam from 4 places. You have to prep and you have to fill, and it would be a various kind of filling or put a crown on. So you would have 15 minutes for that entire thing, because the philosophy there, the kid is not going to wait for you to you know, shake there and wait and be slow. So you prep as fast as you can. So it was very intense. It was very scary. If you fail, you fail. You have to retake it. It was a whole thing, and it was very intense course, but I actually really enjoyed it. We didn't, of course, see patients. There are special pedo models, Model Ts, so it was actually really fun to do. It was a short course, but it was very helpful. I just admire pediatric dentists because I could never do it in real life. So it's harder than it looks now I know that, and that course actually was really great. I wish I had taken more notes for pedo dentistry because that was an incredible amount of information that is not just practical skills wise, but also knowledge wise. He was telling us so many facts that are going to be helpful in our career. So that course was great, and we do not have that course in Boston University yet, but I think we will soon. Another course that I want to talk about that we actually have in Boston University and did not have in Oklahoma is Implantology. And Implantology is actually a really good course here. So they teach you basically everything about implants, and it's not a difficult thing to do. Like, surgery is a very hard thing to do, but easy thing to learn. So there's not much to learn, but we actually went to clinics. We could print our surgical guides, we learned all of the software, and we learned how to place implants on models. Also, like, we learned a little bit of suturing, so it was a good intro to oral surgery. And those are all the memorable big classes that they teach in the preclinical labs that are, you know, simulated. We did not have any oral surgery, which I'm not excited about. We have it as a didactic course, so we only have lectures, but we didn't actually like learn the techniques of extraction. We didn't do the stab lab, which we will soon. I think it's scheduled for May, but the stab lab is when you actually practice anesthesia on your classmates and you stab each other in very wrong places. That's why it's called stab lab. So that's coming, but it's not really taught in the lab, which was taught in the lab in my school back in the days. So next part of the school is didactic courses, and didactic courses in Oklahoma and at Boston University are very different. So didactic courses in Oklahoma were different because you join the second year of dental school and you basically go along with whatever they learn. You have a little bit of extra courses that you were required to have but you missed in their first year, but most of the time you're together with them. So in Boston University you're always alone, so you learn everything you had to learn but in double speed. So in Oklahoma the classes were more relaxed. You would have your vacation, you would have your spring break, you would have your exams, midterms, and finals whenever Americans usually have the exam. Here in Boston University, the courses are stacked, so one course finishes and another course starts. So basically, you always have a midterm. Every week I have an exam. Every single week is a midterm or a final exam, and it's a large percentage of your grade. So didactic courses at Boston University are incredibly hard and just stressful because every single week is an exam. There's no way to relax. In 1 year, you basically have to learn 3 years worth of courses that the DMD students actually learned. I think we have all of them with the exception of a few, like anatomy. We don't have actual anatomy. The most intense classes that caused us the most pain were oral pathology and pharmacology. Those are pharmacology. Nobody likes pharmacology. You always have to get through pharmacology, and I'm going through it now. And we have pharmacology exam every week because the course is very short. We have like 3 or 4 lectures a week of pharmacology. Oh my god, like if somebody told me that back in med school, I would probably say, you know what, I don't need this. I don't need a career. So yeah, that's very intense. So I guess that's everything I wanted to say. This was kind of rambling and turned into more of a comparison between 2 schools, but I think it could be helpful to people who are actually wondering what is there to learn in advanced standing programs. So I hope you enjoyed this video. I really do. I hope you subscribe to my channel if you like to see more videos like this, and I will see you in my next video. Bye. Meow.